You're here because you want the important info, fast, no messing around. We totally get that. Today, we're jumping into hypertrophic osteodystrophy, HOD. It's a pretty big deal if you've got one of those rapidly growing large or giant breed puppies. We're using excerpts from Canine Hypertrophic Osteodystrophy to guide us.
Good source material.
And our mission today, get the basics down, know the signs, and see what this source tells us about this inflammatory bone issue.
Right.
And the really interesting thing, kind of baffling actually, is that even though vets know about it, nobody knows exactly what causes it. Still.
It's true. It remains a bit of a puzzle. So let's get into what we do know.
Let's do it.
Okay, so hypertrophic osteodystrophy, HOD, fundamentally it's an inflammatory disease. It hits the bones of young, really fast-growing large breed puppies.
Okay.
The core problem, according to this material, is inflammation in the spongy part of the bone ends the metaphysis. But crucially, it's non-septic.
Non-septic, meaning no infection. Like bacteria aren't the main culprits here.
Exactly. It's inflammation, but not from your typical bug causing an infection right there in the bone initially.
Gotcha. So focusing on those bones, it's mainly the long bones in the legs, the ones doing all that quick growing.
That's right. The source really points to the ones growing the fastest. Think the lower parts of the front legs, the distal radius and ulna, and the tibia, the shin bone in the back legs.
Okay, distal radius, ulna, tibia.
Yeah. And what's really noticeable is how the bones actually change shape. The metaphyse is that area near the growth plate. They get wider.
Wider? Why?
Well, it's due to swelling from the inflammation, but also the body trying to lay down new bone in response. It's like a reaction.
So the body's trying to fix it, almost, while it's inflamed.
Kind of, yeah. But the process isn't smooth. The source mentions you can get tiny fractures in the bone structure, these trabecular microfractures, sometimes even a bit of separation near the growth plate.
Ouch. Sounds painful.
Oh, it definitely is. And normal bone formation gets messed up. In some cases, you might even see quite a bit of extra bone forming on the outside surface that's called ossifying periostitis.
Wow.
Another key thing to remember is that it's usually symmetrical. Both legs are affected, often the front legs seem worse, though.
Okay, symmetrical, wider bone ends, extra bone growth, very painful. That paints a picture. Now, who actually gets this? Is it super common?
You know, overall, the source says the incidence is actually pretty low.
Really? Low.
Yeah. But there are some interesting patterns. Geographically, it seems most common in the northeastern U.S., especially in the fall. Lowest in winter.
Huh. Northeast, in the fall. Any idea why? Weather? Environment?
The source doesn't really speculate much beyond noting the pattern. Could be environmental triggers, maybe something seasonal.
Yeah.
But it's not definitive. And yeah, it's a dog thing.
Yeah.
Specifically large and giant breeds growing fast.
Okay, so specific breeds must be more prone then.
Definitely. The source flags Great Danes and Weimaraners as the big ones most commonly reported.
Danes and Weimaraners. Got it.
But the list goes on. You also see it reported in Irish Wolfhounds, St. Bernards, Cuvasses, Irish Setters, Dobermans, German Shepherds, Labs, Boxers, Chesapeake Bay Retrievers, Goldens. Quite a few, really.
That is a long list. So if you've got a puppy from one of those breeds, when should you be most watchful? What's the typical age?
The classic window is usually between 3 and 6 months old. That's peak time.
3 to 6 months.
Though the range is technically about 2 to 8 months. And there's a sex thing, too. Males are apparently more than twice as likely to get it compared to females.
Interesting. More common in males. Okay, so we know what it is, who gets it.
Wow.
What are the red flags for owners? What should they look for?
Lameness is number one. Big sign. But the source says it can be tricky. It might come and go. Sometimes it's mild, sometimes severe. It might even seem like it gets better. Then bam, it's back.
Episodic lameness. Okay.
Yeah, and owners often just notice their puppy is off.
Yeah.
You know, depressed, doesn't want to move, not interested in food, and clearly in pain.
Just seems generally unwell and sore.
Exactly.
Yeah.
And then when the vet examines them.
What specific things might they find?
Well, that symmetrical lameness, often worse up front, is a big clue. If you gently feel the ends of those long bones, radius, ulna, tibia, spar, they'll likely be painful, warm to the touch, and swollen.
Warm and swollen. That suggests inflammation.
Right. Plus, they often have a fever, sometimes surprisingly high, like up to 106 Fahrenheit.
Wow, that's high for a puppy.
It is. Other things you might see are poor appetite, acting depressed, weight loss, maybe dehydration, sometimes diarrhea, just a generally run-down, debilitated puppy. Occasionally, respiratory or GI signs pop up too.
Any other less common signs?
Yeah, but the source mentions sometimes you might see thickened foot pads, hyperkeratosis, or even anemia on blood work.
Okay, so it can be a whole constellation of signs really centered around that bone pain and fever, which brings us back to the big mystery.
Right.
What actually causes HOD?
Yeah, this is the frustrating part we mentioned. The source is clear. The exact cause is still unknown, despite a lot of research looking into different possibilities.
Like what? What if they looked into?
Well, they've considered metabolic causes. For instance, maybe a lack of vitamin C.
Hypovitaminosis C. Does that hold water?
Not really, according to the source. The thinking now is that if vitamin C levels are low, it's probably a result of the HOD, not the cause. Maybe the body's using it up during all that messed up bone activity.
Okay, so vitamin C deficiency is likely out as a primary cause. What else metabolic?
Low copper was another idea, seen in some other animals, but hasn't panned out consistently in dogs with HOD.
Right. What about nutrition? That seems like a common concern with big, fast-growing puppies. Too much food, too many supplements.
Absolutely. Overnutrition and oversupplementation have definitely been looked at. Makes sense, right?
Yeah, seems logical.
But the source says the connection is, well, inconsistent. It doesn't always hit every puppy in a litter, even if they're eating the same thing. And just changing the diet doesn't always fix it or stop it from coming back.
So diet might play a role, maybe makes them susceptible, but it's probably not the whole story on its own.
That seems to be the takeaway. It's likely more complex than just food.
Okay, so if it's not purely metabolic or nutritional, infection, bacteria, fungi.
They've considered that too. Sometimes bacteria or fungi are found, but the source suggests they're probably secondary invaders, like they take advantage of the already inflamed, weakened tissue.
Opportunists.
Pretty much. And importantly, HOD itself isn't considered contagious. You can't pass it from one dog to another.
Okay.
But there's a really interesting point made about vaccines, specifically the canine distemper virus vaccine.
Oh, what's the connection there?
It's described as a temporal association, meaning sometimes episodes seem to occur, not long after a puppy gets vaccinated for distemper.
So, like, the vaccine might trigger it in some dogs.
That's the idea proposed. Not that the vaccine causes HOD directly in all dogs, but that in certain puppies who are maybe already predisposed, the vaccine could act as a precipitating factor. It might kick off an sort of uncontrolled inflammatory reaction in those bone growth centers.
Wow. So it's listed as a potential risk factor or trigger, not a cause, but a potential spark in the right or wrong circumstances.
Exactly. It's important context. Suggests maybe an immune system overreaction in susceptible individuals.
That's fascinating and definitely complicated. Okay, so if a vet suspects HOD based on the signs, what else are they thinking about? What needs to be ruled out?
Good question. Differential diagnosis is key. The source lists a few main things. Panocytitis is one that's another bone pain issue in young, large breeds.
How is that different?
Pano typically doesn't cause that specific swelling right at the metaphyses, the bone ends. And the X-ray findings are different. Usually involves increased density inside the bone shaft, not those lucent lines near the growth plate.
Okay, different location, different look on X-ray. What else?
Septic metaphysitis or epiphysitis, that's a bone infection, usually bacterial.
Ah, so that is septic.
Right, and it's often asymmetrical, affecting one leg more than the other. Plus, you'd likely see signs of infection on blood work.
Got it. What about things like elbow dysplasia or OCD? They cause lameness too.
True, but conditions like elbow dysplasia or osteochondritis dissecans usually cause pain localized to a specific joint. You don't typically get that widespread swelling at the ends of multiple long bones, and usually no fever like you see with HOD.
So more localized pain, no fever, no metaphyseal swelling.
Pretty much.
Yeah.
And then there's polyarthritis inflammation in multiple joints.
Yeah.
It can be septic, infectious, or non-septic, immune-mediated maybe. But again, that's primarily inflammation in the joints, not centered on the metaphyses of the long bones like HOD is.
Okay, so that pattern of symmetrical, warm, swollen, painful bone ends plus fever in a young, large breed puppy really points towards HOD, but you gotta rule out those other possibilities.
Exactly. The clinical picture is pretty characteristic when you put it all together.
What about lab tests, blood work, urine tests? Do they help confirm it?
The source says routine labs aren't really definitive for HOD.
Oh, so they don't give you the answer.
Not directly. You might see what's called a stress leukogram, just changes in white blood cells, indicating the body is stressed or inflamed, but it's not specific. Most other blood chemistry values, like kidney and liver function, are usually normal. Sometimes calcium might be low, but that's described as uncommon.
So blood tests don't really nail it down. What does? Imaging.
Yes, radiographs, X-rays are really crucial.
Okay, what do the x-rays show?
You look at the affected limbs, especially near the joints. The source describes seeing these irregular, sort of shadowy zones, radiolucent zones, in the metaphyses, right next to the growth plates.
Like a line or area where the bone looks less dense.
Exactly. Sometimes called a double physial line. And you'll often see those flared, widened metaphyses we talked about.
The wider bone ends.
Right. You might also see new bone being laid down on the outside surface, that extraperiosteal new bone. Sometimes even mineralization, like calcium deposits, in the soft tissues around the bone ends. And because growth can be uneven between paired bones, like the radius and ulna, you can sometimes see bowing of the leg or the paw angling outwards of valgus deformity. And remember, these changes are typically symmetrical.
Symmetrical changes, lucent lines, flared ends, maybe new bone. That sounds pretty specific on x-ray.
It really is quite characteristic. The source also notes that it rarely affects bones like the vertebrae, ribs, scapula, or jaw. It's mostly those long limb bones. Oh, and chest x-rays sometimes might show lung inflammation.
Interesting. So x-rays are key for diagnosis.
Yeah.
What if you looked even closer, like at the tissue level, pathology?
Yeah, the source touches on that grossly, meaning just by looking at the affected bone, you'd see those wide metaphyses, maybe mineral deposits around the edges, and swelling in the nearby tissues. Again, most severe usually in the distal radius and ulna.
And microscopically,
Right.
under the microscope.
There you see the evidence of that inflammation. Lots of inflammatory cells, but crucially, non-septic, so no bacteria usually seen right there. It's happening right near the growth plate. You also see cell death, necrosis, and problems with how new bone is being laid down. Those microfractures we mentioned are visible too.
So disrupted bone formation and inflammation.
Exactly. And mineralization can happen in soft tissues elsewhere too, potentially even leading to interstitial pneumonia in the lungs.
Wow, so it can have effects beyond just the bones. Okay, knowing all this, how do you actually treat HOD? Is there a cure?
That's the thing the source emphasizes. There's no specific cure. Treatment is all about supportive care, managing the symptoms, basically.
Supportive care, what does that involve?
Well, for puppies that are really down, maybe can't even stand, good nursing care is critical, turning them often to prevent bed sores or pressure sores, and also to help prevent lung congestion.
Makes sense.
Fluids are usually essential too. Intravenous fluids initially to combat dehydration, then maybe maintenance fluids. Activity restrictions, super important.
Keep them quiet.
Absolutely. Strict rest, no running, no jumping, just very short leash walks, ideally on soft ground, just for potty breaks. Minimize any stress on those painful bones.
What about diet during treatment?
Just a normal, good quality puppy food, appropriate for their breed and age. And the source specifically says avoid supplements.
Avoid supplements, especially vitamin C, like we talked about.
Exactly. Vitamin C is specifically mentioned as potentially counterproductive. It might even worsen the abnormal calcification process.
Good to know. Avoid Vit C. What else?
Client education is huge. Owners need to understand this can be a relapsing condition that might come back. And there's a possibility of permanent bony changes, like bowing, although sometimes those can remodel or improve a bit over time.
Managing expectations is key.
For sure. Surgery usually isn't part of the plan, though in really severe cases, a feeding tube might be needed if the puppy won't eat. And much later, corrective surgery for significant limb deformities is a possibility, but not common during the active disease.
Okay, so mostly nursing, rest, fluids, proper diet, no supplements. What about medications for the pain and inflammation?
Yeah, meds are central to managing the symptoms. Anti-inflammatory drugs are the mainstays. They help with both the pain and the fever.
Which ones? Like NSAIDs?
Yes, non-steroidal anti-inflammatory drugs. The source lists several common ones used in dogs, things like carprofen, loxicam, firocoxib, daracoxib, others too, with typical dosages. Aspirin is mentioned as well.
Okay.
And often additional pain relief is needed on top of the NSAI. Drugs like tramadol can be helpful for that extra pain control.
What about steroids, like prednisone?
Prednisone is mentioned as an option, sometimes used, but the source includes a note of caution because steroids can potentially impact the growth plates in young animals, so it's used carefully.
Right. Always a consideration in growing pups.
For really severe pain, sometimes stronger meds like opiates might be needed for short-term relief. And again, just to reiterate, vitamin C is listed as contraindicated, don't give it.
Got it. Any other precautions with meds?
Yeah, standard NSAID precautions apply. Watch for stomach upset or ulcers. And never combine different NSAIDs. or give an NSAID at the same time as a steroid like prednisone. That really increases the risk of side effects. Also, if there's any suspicion of a secondary bacterial infection, immunosuppressants should be avoided.
Okay, makes sense. Careful use of NSAIDs, maybe additional pain relief, possibly steroids cautiously. Definitely no Vit-C. So once treatment starts, what are you looking for? How do you monitor them?
You're watching for improvement in the clinical signs. Is the pain getting better? Are they more willing to move? Is their appetite coming back? Is the fever gone? Those are the main things.
And what are the potential bumps in the road? Complications.
Unfortunately, there can be complications. Severe weight loss or cachexia can happen if they're really sick and not eating. Those permanent limb deformities, the bowing, can occur. Secondary bacterial infections are a risk. Pressure sores if they're down for a long time. Muscle twitching or even seizures can happen if calcium levels get too low, though that's less common. And in really severe, rare cases, you could potentially see systemic issues like blood poisoning. Recurrence is always a possibility too, and sadly, very occasionally, it can be fatal despite treatment.
Okay, so it can get serious, although most recover. What's the typical timeline for an episode and the overall outlook?
An individual episode usually lasts anywhere from several days to maybe a few weeks.
Okay.
The good news is most puppies only go through 1 or maybe 2 episodes and then they recover fully.
That is good news.
Yeah. But some dogs, unfortunately, do have multiple relapses that can be really tough to manage. So the overall prognosis is generally considered good for most, but it becomes more guarded if they have lots of relapses or develop serious complications.
And those limb deformities.
If they persist, even if the dog is comfortable, significant bowing can obviously impact things like a show dog's career or potentially athletic activities later in life.
Right. Okay, so let's try and wrap this up. We've learned HOD is this painful, inflammatory bone issue in young, big breed dogs growing fast. Key signs are that symmetrical lameness, fever, and those swollen, painful bone ends, especially near the wrists and ankles. X-rays show some really characteristic changes near the growth plates.
Right. The diagnosis relies heavily on that clinical picture and the radiographs.
And treatment isn't a cure. It's supportive rest, pain relief, anti-inflammatories, good nutrition, no vitamin C. And thankfully, the outlook is usually pretty positive for most pups.
That's a good summary. Supportive care is key.
But the big takeaway still is that we don't know the exact trigger, despite knowing so much about what it looks like and how it progresses.
Exactly. That fundamental cause remains elusive. It's quite remarkable, really.
It really is. Which, it leaves you thinking, if there's this potential link, maybe a trigger with vaccination in some dogs, what else could be involved? What other maybe subtle environmental things or even genetic factors might make certain puppies susceptible?
That's the million-dollar question, isn't it?
Yeah. And what kind of research could finally crack this? Could understanding the trigger lead to, I don't know, better ways to prevent it or treat it more specifically? Definitely something to keep an eye on in veterinary research.
Absolutely. A lot left to learn.
Well, thanks for diving deep into HOD with us today. Hopefully this gives you a much clearer picture of this condition.